Hi guys, I want to have a chat with you today about something more basic but fundamentally important, and that is dental decay and ultimately how it forms and how you can help to reduce your chance of getting dental decay. So tooth decay, cavities, dental caries, whatever you want to call it, it's caused by sugar in the diet, and that is the ultimate thing. It is always caused by sugar in the diet. So when you eat sugar, you are not only feeding yourself, but you are also feeding the billions of bacteria that reside in your mouth, that call your mouth home. Even a clean mouth is full of billions of bacteria. Like you, when these bacteria get fed with sugar, they create waste products, and it is these waste products that ultimately damage the tooth and lead to dental decay. So when you have something sugary, the bacteria in your mouth, they get fed, they create an acid waste product, and it is that acid that attacks the surface of the teeth and eventually leads to the cavities forming. So when you have something sugary, we can measure the pH or the acidity of your mouth, and it has been found that if you expose your mouth to sugar, the pH drops, you get into the danger zone, and it stays low for about 30 to 40 minutes. And that one dose of sugar, then that drop in pH, that damaging zone, we call that a sugar exposure. Now, teeth can cope with a bit of sugar, okay? You can safely expose teeth to sugar about 3, maybe 4 times a day, but I always say 3. 3 is fairly safe. And that's why we advise anything sugary, keep it to meal times, avoid sugary snacks between meals, because that's when you're going to damage the teeth. So I mentioned a sugar exposure. That doesn't matter how much sugar. So in terms of teeth, how much sugar you have does not matter. Obviously it matters to your overall health. Too much sugar can cause obesity, it can cause diabetes, it's linked in with cardiovascular disease. But from your teeth's point of view, how much doesn't matter. It's how often you have it and for how long a duration you have it. Now, we often see parents, one kid's got decay, one is not, and they're effectively having the same diet, and the parents are confused. And this often comes down to how they eat it. So knowing how decay forms allows you to eat sugar in the least damaging way possible. So the least damaging way to eat sugar is to have it with a meal time, to keep the length of exposure as short as you can, because as we know, every time you have sugar, the pH drops. If you just have it for a short period of time, it's going to return into that safe zone pretty quickly. If you have it for a long period of time, you're in that danger zone for a long time. We want to keep the number of exposures low as well. It's just in allowing that damaged tooth to repair itself. When it's washed about in the saliva helps to heal the damage. So as well as modifying how you eat sugar, maintaining good oral hygiene helps as well. Removing that plaque from the teeth. The plaque is where the bacteria live, and that then go on to cause the decay. And using a fluoride toothpaste of appropriate strength for your age. So fluoride does not stop decay. Toothbrushing does not stop decay, but they help. So when you have a tooth and you expose it to sugar, the bacteria that live on that tooth then create the acid environment and they damage that tooth. The fluoride gets absorbed into that damaged tooth and helps to repair it. But ultimately it is sugar. And it's not how much sugar you have, it is how often you have it, having it too frequently and having it over too long a period of time. So if you want to have a sugary snack, keep it as close to a meal as you can, eat it as quickly as you can, and keep the number to a minimum.